Hey everybody, what's up? Welcome back to the channel. I'm Chad. She's Allycia.
I am Allycia.
Okay. And this is the Pit. So we're getting ready to dive into episode 12. And I am nervous
Yes.
to get into this. The way the last one ended, obviously we have an active shooter situation, potentially mass casualty event coming from Pitt Fest. And then of course Robbie's son and his girlfriend are there. So let's just add to the drama here.
Yeah. Andy sent everybody home.
Yeah, he's very short staffed. We don't have Dr. Langdon. Collins is, although she probably didn't actually leave, right? Like
I don't know. I don't know.
I think he just told her to go home, and we'll see.
Wasn't Dana going home too?
Well, she pretty much had decided that she quit.
Oh, that's
like,
right.
She was fed up with.
But he was with her when got the call, right?
Yes.
Okay.
So Dana's probably not going anywhere.
Yeah.
Yeah, I think that, again, kind of touching on the last episode, violence against healthcare workers. She kind of alluded to that, right? Like she's been kicked, punched, clawed, scratched, yelled at, all those things over the years. This one really did it for her. And I think they're just getting at, like, at the end of the day, we are trying to help. You know, they are trying to help. And I know that sometimes maybe the responses from the care team maybe don't seem that way if they seem a little bit abrupt or curt or abrasive at times, but they are just trying to help. And so then it's sort of like that whole, no good deed goes unpunished. And then, right. So I think that's where we are with this, with her, but we'll see.
And I think we are going to probably see a lot of Kiara.
Yeah, the social worker.
Yes.
Yeah.
We had a comment about someone that works as a social worker. I think she said she was from Australia.
Yeah.
That was like, she was a little taken aback that nobody could remember that she was a social worker.
Well, shout out to her and to you, because without the work that you guys do, the whole thing would fall apart.
Yes.
So, but thanks for checking us out from down under.
Yep. Special place in our hearts.
Can't wait to get back sometime.
I know.
Anyway, thanks for all the really supportive comments. It has been a lot of fun reading those, sharing those with each other, and then of course continuing to grow. So thank you for subscribing, for those of you who have subscribed. For those of you who have maybe been on the fence and are like, let's see, give it a couple more episodes to see if we really like them.
I don't blame them. They don't like it, but I don't want to deal with those weirdos.
Please consider hitting the subscribe button, like, comment, all those good things. Apparently that helps YouTube decide throw our stuff out. So this is episode 12. We said at the beginning, right? 6 p.m. So we're almost dinner time. This shift's got to be getting close to being over.
Do they get to eat dinner?
Not if they stay at the hospital. They don't.
Okay.
Maybe. Hopefully. I mean, the cafeteria probably closed. So, unless they packed lunch or door dashed.
Okay. We are thinking way too much on this. Let's...
All right. So hitting play now. All
right.
Hey, Jake.
You're home, stay home.
Listen, man, or text me the second that you get this message.
Hour 12, 6 to 7.
Up a command center and administration, mobilized communication.
The night shift is going to be here soon, but we are going to need more help.
MCI group text and emailing out to everyone, including services.
Okay, good.
Well, this is where administration is really coming in.
Yeah, I mean, obviously, this is where we truly are a family.
Yeah.
Surgery's got to call in the cavalry. We're going to need all 25 ORs.
And staffed, and we're working on getting the rest up and running.
What about disaster supplies?
On their way.
Every patient in the ER needs to go up. Beds or no beds. There's hallway then ignored down here.
Agreed.
Wow.
A whole wing that's empty on the 8th floor. I don't know if that's...
No comment on that one.
It's like, not the time.
It's like, I'm not going to push my luck. You're giving me what I want.
Will do. Thank you.
Hey, what's going on?
Mass casualty at Pitt Fest.
How many victims?
We don't know. Expect the worst.
Did the police find David?
Probably the wrong time to bring that up, but I get,
I think that's probably crossing everybody's mind.
We are instituting hospital-wide emergency protocols. Need to move every patient out of here. They go upstairs or they go to family medicine. Call your loved ones now if...
Family medicine. I don't know what that means.
I mean, you know what family medicine is, but...
Full briefing in 5 minutes, brother. I'm so glad to...
Oh, well, he's back.
Emmy Award-winning Dr. Abbott.
Yep. Maybe this is the episode he wins the Emmy for.
Where do we put the disaster bin?
Behavioral health, that's...
Let's go. We got more bins coming.
What is this stuff? I know you...
Yeah, I don't know. Crash carts, I guess, like full of emergency supplies.
Well, this is post-COVID. We didn't have those during COVID.
Didn't have what?
Emergency supplies, right? Wasn't there a big shortage?
There was a shortage on protective gear.
Oh, okay.
The ERs
That's
have always
different.
had like crash carts or.
Okay.
Please make sure to take all your personal belongings with you.
Sorry for any inconvenience, sir, but this is an emergency.
This is an emergency room.
Well, they can't really say anything.
Yeah.
And sedatives that they can.
Consider it done. Not yet, but you know, teenagers keep trying.
Mom, Janie, she's in my phone. Tell her what's going on.
Dana's sticking around.
Try Collins. See if you can get her to come back.
Yeah. What about Langdon?
Desperate times call for desperate measures.
4 gurneys in each of these trauma rooms, so make sure you wows, ultrasounds out of here. We're not going to have time or space for.
WOWs means workstation on wheels.
Oh,
They used to be
okay.
called cows, computer on wheels, and somebody got very upset because patients thought they were being called a cow.
Is that like a true thing
Yeah,
across all hospitals?
I mean, I don't know. I thought it was our hospital. Maybe that was just a tall tale.
No patient goes into a room unless it's a trauma bay, and everybody out in the open so we can keep an eye on everything. And assign every patient to a specific zone. Patient who comes in with a red slap band, trauma rooms with overflow out here. These critical patients will die without immediate attention.
Every hospital has a protocol like this?
To my knowledge, there was no protocol like this in my hospitals.
Okay.
We were not a trauma center, though,
Oh, okay.
or certainly weren't a level 1 trauma.
Oh, if you can't feel a pulse, for Doppler flow with this. It's a mini ultrasound. Follow the screen prompts.
Change to a red if they go south. You got to stand.
She looks terrified.
Trauma surgery and neurosurgery, or immediately who goes to the ICU for further treatment and evaluation. Ask for help if you need it. Trust your attendings. We'll get through this together.
Damn right we will.
You ready?
Yeah, no. They're he's done this before. I mean, obviously it's a show, but
Yeah, I think he did do it before, back on ER.
Disaster bin?
Empty plastic boxes right there. You can't miss it.
Where's Collins?
But Dana is calling her now. Don't worry.
I think this show appears a little too real.
Yeah, well, so they've taken things that happen, they've bunched it all together. So like all the stuff that's happened during this shift is probably more than you would see in a typical ER shift.
Yeah,
but it is all things that happen.
Where the hell did Myrna go? The cuffs off Myrna?
Hell no. That woman scares the shit out of me.
God.
Now she's wandering around the hospital.
Yeah. Did they ever say why she had the cuffs on?
Well, I think they made the joke that so she didn't steal the wheelchair or something like that.
Oh.
But I think that was a joke.
I was still a resident 3 months ago.
Well, one patient at a time, right? Goal is to triage each patient in 10 seconds. Status is AVPU, alert, responsive, pain, unresponsive.
How the heck do you remember all this? Like, let's say as a doctor, but let alone, or as an actor. Like, gosh, it's a lot.
Heard of my rain today. Yeah, man.
Mental status and pulse.
I can't remember anybody's names.
So with no pulses, slap a black and white band on him, send him anymore.
This guy doesn't seem quite as, I don't know, doesn't seem to have the urgency that Robbie has.
Yeah, drinking coffee casually.
Dude, relax. I got the front door. You worry about the back.
I think he's a little concerned about his cavalier attitude.
Yeah.
Right chest, strong radial, pink. What's this? That's priority boarding. You're gonna be okay. Let's check out this band. Yep. The woman over there, you need to speak to her. What? Your son had something to do with the shooting.
This gave me chills.
Why?
I don't know.
Son Omar.
Omar, can you open your eyes for me?
He's dead.
Gurney, you will be very close by, I promise.
My car when we were wheeling.
Okay, we'll see you in.
Oh my gosh.
I'll take her up. Dr. Mohan, that kid came in with his mom. She says he's deaf.
Ready to go with the ONEG.
Oh, positive for males over 13, women over 55. ONEG for everybody else.
That's interesting.
OR if we stabilize this surgical ICU instead.
IO's in, go with OPAS. Time, bone marrow infusion's as good as an IV.
You ever seen that?
Yeah.
Bone marrow infusion.
If you need a real quick access, then you go into the bone. And you can deliver like large volumes to an IO.
Start with the intubation.
Like quicker?
Well,
Quicker recovery?
No, like it can withstand high volume resuscitation as opposed to like a small peripheral IV.
Okay.
I got separated from my son, Omar, shot in the chest. I'll let you know as soon as I find out anything.
You write down the O negative female thing. Talk about it. I had a question about that.
Unresponsive, had a weak femoral, lost it.
There's no response, call it. No pulse, no OR.
Gunshot to the head. Strong pulse. This one can make it because the intercranial bleed.
Walsh, neurosurgery in the house.
To the neurocrit ICU, the trailers from there.
Okay, you guys good in here? You got
Got this.
This just looks exhausting. Or their adrenaline's pumping. Like,
Yeah. I mean, obviously I've never been part of a situation like this, but these are the types of, we'll say, days or experiences that honestly provide some of the most rewarding feelings of being a doctor. Because your ability. Oh, wait. Langdon.
oh, was he? He came in on it.
I'm stabilized. You should not be here. Larry, headwinds don't go to yellow. Triage says yellow. Hold on. I've got this. Trust me. Oh, we're a little late.
Yeah, I kind of think you don't have a choice right now.
This is Grayson Cooper, 68. Bullet grazed his scalp.
I got lucky.
But before I got so sidetracked there is a certain sense of reward of being able to help in these types of situations. Like, it's exhausting, but you walk away feeling like you did something.
So you've been in a situation like that?
Not, I mean,
not like quite like that.
Codes or rapid responses, things
Yeah.
like that. I mean, not mass casualties.
Need to assess your injury.
Fine, help the others first. Please, I'm fine.
Sir, are you taking any medication?
Just medicinal marijuana.
Yeah, what do you take that for?
Glaucoma.
Everything.
Everything.
That's a good answer.
Omar, he was shot in the chest.
He is upstairs with the surgeons in the OR. Find you when I know more.
Scanning, looking for his son.
Oh, that's what he's doing. Yeah.
I'm assuming. Yeah.
I'm sitting here thinking, and I know this is not like a thought, but like if you're going from patient to patient with the same gloves.
Yeah.
Yeah. Just blood.
Which is, yeah, I don't know that I would say that.
I mean, I know they're just doing what they can, but.
Okay, sounds good. You need anything?
I was hoping for Thanksgiving and Christmas off this year. We can talk about it later.
Yeah, he's just so like relaxed.
Stop.
Yeah.
That's just how he.
I don't need you teaching me right now.
You're already an expert.
Read the fucking room, Mom. About to place a horizontal mattress, in case you're wondering.
Good for her to stand up for herself.
She feels validated now. Okay.
Okay, yeah, we can fix that with rainy clips.
What are those?
I need them in neurosurgery to clamp off the scalp before opening the skull.
You guys are swamp. I got this. Takes a village.
That it does.
I mean, did the special
Whitaker?
effects? I had a feeling
Sylvia,
that
can you hear me?
she was going to be triaged wrong.
Lost her radial pulse.
From a broken leg?
Well, what did we miss?
Heart attack? Another injury from the car crash?
That's repulsive.
Maybe like a fat embolism from the bone, like bone fractures.
Diagnosis made. Blood in Morrison's liver laceration.
Car hit the belly. Leg was a distracting injury.
She got hit by a car.
Yeah.
I was going to say, I'd be shocked if the special effects department didn't win something for this.
Yeah. They may have. I don't know.
Yeah.
Somebody tell us.
Somebody what?
Somebody let us know.
Oh.
3 West is full. Take them to 2 South.
Cut 4x4s and elastoplast tape.
You're here.
In the flesh. What do you got?
Then we found an occult liver laceration.
Stabilizes with blood. She can wait an hour for the OR.
Son's in the OR with the GSW to the chest.
Family reunion and post-op.
Whitaker?
Okay. I mean, how much stuff is he on right now? It's like, looks revved up. I mean, maybe he's not, but.
I don't know why, but I've started to really like Langdon and not because he's an addict, but I just kind of like his renegade style.
Yeah.
Okay, well then go back to your bed.
My son is down here.
Sorry, sir, but no one's in and out unless they're on a gurney.
My wife is an ER doc, Dr. McKay.
Oh.
If you're not back in 5, I'm coming after you.
Yeah, okay.
Yeah, okay.
Need some help over here?
Okay, I'll be right back. Jabati IO. Here too.
Sux is on board.
I got it.
Is he in awe of her or is I'm confused?
Yeah, probably. Pretty awe-inspiring.
You can't be in here. Sit with Harrison in the staff lounge. Okay. Now!
Okay.
Yes, ma'am.
I think he's just in shock.
Well, yeah.
Hey, buddy.
Did you have your surgery?
No, it got delayed. Ready to go home?
Mom said that Grandma and Grandpa McKay were picking me up.
I'm not sure they can get here right now. I can Chloe, but, we can Uber to my place.
How are you going to Uber?
I'd rather go home with Mom if that's okay.
Your mom's got her hands full, dude, and I think she's gonna be here pretty late.
I can wait.
Okay. Yeah, okay.
Good job, Chad.
I love how on these like shows and stuff, when they have iPads, they don't have cases on them. Like we would ever give a kid an iPad without a case.
I know. Even with the cases, we've gone through multiple iPads.
I know.
Responsive even to pain. No GSW, but tachycardic and diaphoretic. Looking for internal hemorrhage. Fast negative.
Help me roll it.
Tim!
Diabetic.
Diabetic, maybe low sugar.
Hypoglycemia.
So check a blood sugar.
No time for that. My spidey sense is telling me she took her morning insulin, but she skipped lunch. She's in a coma from low blood sugar. These are healing hands.
Oh my gosh.
Shooting at Pitt Fest, but you're safe now. MCI 33 to yellow for monitoring. What are you doing?
Ran out of laryngoscopes, no time to autoclave.
Oh man.
More coming from Presby. Running very low on neck.
Perfect storm.
When they put a call out for donors in that situation.
For blood product, I mean, I don't know that you would have enough time to mobilize a meaningful response.
What did this guy last eat?
We never know down here.
Practically pressure if his vomits were.
Doctor?
Hold on. Oh, yeah, this is a tough one. Oh, yeah, this one. No shit. Prep the neck.
Hold on, okay?
Yeah, PR, did we lose the pulse?
Just give me one good push.
Interesting.
Okay.
They're putting in a breathing tube.
Mm-hmm.
Okay.
Yellow, we're good. How did you do that?
You do that to make sure you're actually in the right place.
Do what?
You have to check. You can check your placement.
Oh, okay.
Because typically after you intubate, you would have an x-ray come in and make sure that you're in the right spot.
Massive subcutaneous emphysema. Air from the chest is leaking under the skin.
Yeah, well, she just said it, so.
Okay. So releasing air out of his chest by cutting. Okay. Oh, interesting.
Pulse is coming up. Nicely done. Okay, send him to cardiac.
I don't know that I've ever seen like air bubble out like that, but then again, I've
Never probably seen that procedure.
I've never cut into their chest like that.
Yeah.
Hey, where'd this guy go? MCI 28 arm injury who refused treatment?
Maybe he left?
There's a gunshot wound?
Hey, what the hell are you doing?
Fine. Leave me alone.
We need security in here.
Oh gosh.
Oh, that's what he gets.
Well,
She's laughing.
might need to be re-triaged.
Fucker.
He didn't even
This
have a
guy stole a
gunshot
victim's
wound.
hoodie and faked an injury to get inside. It's probably. Hey, wake up, you faker.
Uh-oh.
Yeah, response to pain.
Oh, okay.
We're out of chest tubes.
What the hell? Could have told me that before we started.
I didn't know.
I only
Tube, and if you inflate the balloon, it won't pull out. Fine, set up a thoraceal.
Oh, for the love of God. Hearing bag? How am I supposed to connect to that?
Christmas tree adapter. It'll work.
This is all very unconventional.
Yeah, well.
This is genius.
Oh man, he just reignited that flame.
Good job, Utah.
Central 789 is now the blood donor center. Your O-Pods, we need you to donate now. Hands right.
There we go.
Okay, let's do this.
I had noticed you didn't raise your hand.
Me, I know.
Can I have your attention, please? Kiara Alfaro, I'm in emergency department.
There she is, Kiara.
In order to help you, we have a QR code you can scan for our patient identification website. Once you log on, send us the name, whomever you're concerned about.
Tell us what they were wearing.
When she was holding up the QR code, I was like, she needs to say something about patient satisfaction here.
Really?
5 stars, please.
How's she doing?
500 of saline in. She's barely with us now.
This unit of whole blood.
Yeah, see if you can find a pressure bag.
Much faster if I just squeeze it in myself.
Oh.
Need some help with an airway? GSL beats the neck with expanding hematoma and distorted anatomy. Can't intubate him, probably hit the carotid.
Yeah, I feel like
Okay.
I'll do the airway.
seeing things go
So,
south.
yeah.
I mean, obviously it's already bad, but so far they've all been making progress, it seems.
Step process. Step 1, scalpel. Step 2, finger. Step 3, bougie. Put in the tube. Good, that's far enough.
So that serves as a guide wire.
Oh, okay.
Robbie, blood's arriving.
Oh, right on.
Eviscerated bowel, fresh ABD and saline.
Is that for a sec?
3.375 Zosyn and a sterile dressing.
Saying this, another Christmas tree and Foley bag. We ran out of chest tubes.
They're gonna wonder what the hell we're doing down here, but it was a great save.
More chest tubes, courtesy of Presby.
Awesome. I'm gonna go check out triage.
Presbyterian.
Waiting for the FBI to get here.
They find her son?
They pinged his cell phone to the area to shoot him.
Are we gonna be safe out here?
Should be now. Focus on the patients. Focus on the patients.
My way out is through. Any idea how many more come?
Sending all these ambulances back to the scene for more victims. We may not even be halfway through yet.
When is this gonna end?
And it's
Oh,
over.
Gosh. Like, that did seem to go really quick.
Yeah. So the next episode's going to be worse.
It's just continuation. All right. Well, hey, we're in the proverbial war zone here.
Yeah.
Kind of like Dr. Abbott was saying there, like this is basically like MASH medicine. Like this is war zone medicine.
MASH, that show that used to come on every night. It was the only thing on TV when I was little, like after a certain time.
Did you watch MASH?
I did.
Oh, I didn't.
I didn't have any choice.
Yeah.
It was all it was on.
So one of our good friends, Mark, had made the comment that we need to watch MASH. So maybe we'll put that
I don't
on
know
the
if I
list.
can go back that far.
Really? So I guess MASH was I think set in the I guess was it like part of the Korean War? I mean, this is going back quite a ways, but I don't know. Anyway.
Yeah. Okay.
All right.
Sidetrack.
Yeah. So I mean, I don't know, a lot to unpack here, but I don't even know where to start.
Dr. Robbie
Thoughts?
hasn't heard from his son.
Yeah. So no, and hopefully that means hopefully everything's fine, right? There was chaos, so not be okay. So actually, this made me think about New Orleans and Hurricane Katrina. And so kind of getting a little bit of a circle back to that, we talked about that in earlier episodes with Robbie having trained at Big Charity Hospital. We talked about, which by the way, I know in one of the discussions with one of those prior episodes, I'd mentioned that documentary, Big Charity. We actually watched it, and it was very well done. It was very interesting. I'm not going to dive into like a recap of that documentary, but go watch it if you're interested. And then there was a comment from somebody who said, asked if we had seen, was it like 5 days at Memorial or 5 minutes at Memorial? And so thank you for that comment, because I had never heard of that. And so then I went and looked it up, and it does look really good. So that is something that I'm going to add to the watch list as well. But this made me think of that, because you had almost no supplies, or at least we're running out of supplies. You had no way, and of course in that setting with Katrina, you had like no way out.
They didn't even have electricity.
Yeah, like you had true...
Once the generators ran out.
Right, generators went out, the flooding, the levees broke. And there were several days, 5 days at Memorial, I guess is based on that, right? So you had days without adequate supplies, patients dying. Obviously, they weren't gunshot wounds, but it was obviously a very critical situation there. So that kind of, frankly, that's what made me think of that, like the chaos of working in that sort of setting.
Well, I know it's not the same chaos, but when you were in the hospital when COVID hit.
I was not in the hospital.
You were in the hospital?
No, I was.
Okay, you were just.
No, I was done. I was in.
You had completed residency. Okay, all right. Yeah. I mixed that up.
So no, but yeah, I mean, well, there's callbacks to that also, right? So like first few episodes, Robbie having flashbacks of that. So similar, right? Running out of materials, running out of supplies, having patients sit on beds in the middle of the hallway, and so a little bit of parallel there, I think, with this. And then, so I really hardly wrote anything down. The only other thing was what you requested was to talk about the O negative.
I know it seems trivial now, but he said O positive for males 13 and older. Is that what he said?
So I didn't hear exactly the
then females O negative. Oh, is that because of the rhesus factor?
Yes. So yeah, I didn't hear exactly what like the requirements were, but yes, like you would not want to give a woman, particularly one of childbearing age, a positive blood type, especially if they themselves were negative, right? Because then you could form the rhesus D or anti-D antibodies, which then if they were to say develop a subsequent pregnancy, that could be problematic. And so that's why.
I only know that because I'm negative.
Yeah.
And I've had babies. So
yep.
That's the only reason I know about the rhesus factor.
Mm-hmm. Yep. So that's why. I said I don't know all that. I didn't hear exactly what he called out, but that's why he was saying that.
Yeah, makes sense.
All right. So this was 12. So then we have
13, 14, 15, 3 episodes. Yeah. Okay.
Which I'm assuming then, because I was wondering why there was still like 3 episodes left when he had made reference to there only being an hour left.
Yeah, I've thought that actually on earlier episodes.
But I'm assuming that's because this happened, and so.
Oh, it extends the shift.
Well, yeah. I mean, he's not going to be like, all right, Abbott, high five, I'm out. Like,
I thought it was going to be like a post-shift thing.
No.
Like, we're all going to be happy.
No, but I guess kind of showing, though, that when you work in medicine, your shift is sort of a suggestion, not really not really like gospel. And so nurses can attest to this, certainly handoffs, like when, say, the night shift comes in, depending on what's going on.
Yeah, if they're in the middle of a code,
right?
They're just gonna be like, "Oh, my shift's up."
Right. So then often, it's not uncommon for there to be that handoff gets delayed. Same thing when we would go in and do our, say, sign outs with whether it be the night shift or if we were working night and day shift. And then you have what's called post call, which sometimes then can, I won't get into all that.
Yeah.
But point is, your shift is not typically etched in stone. It is more of a suggestion, and you're lucky if you end up getting out right at time. So again, the show, I think, highlighting on all of those elements of being a healthcare worker. So, all right, well, we're going to get into this next episode. I was kind of nervous for this episode based on how it ended. I'm not as nervous now. I'm actually a little more like amped up. Obviously, I'm sure there's still going to be some sad things that happen. But okay.
Yeah.
Kind of like I was saying, like, obviously this is a horrific situation to be involved with. And these are the situations that, you see Langdon, right? Langdon's in his element, right? He is kind of in a way enjoying this, likely. As I say that, like, no, he does not.
I know what you mean.
You get what I'm saying. Like, he's thriving though. Like he's doing what he was trained to do, right? With his calling. And that's why I was making that comment earlier, that even though it's tragic and even though you're going to leave from here with second guessing yourself, you're going to be wondering, did you do everything you could to help everybody that you could? And there's going to be lots of that going on. But at the end of the day too, this is where you feel like you're satisfying your calling, I guess that's what I was trying to say.
Yeah.
All right. Anything else?
No, that was a lot.
Yeah.
Yeah.
To be continued.
I know.
All right, guys. See you next time.
All right.
Take care.
See ya.
I am Dr. Todd.